What if I told you that a simple cough in your baby could turn into something much more serious overnight? Bronchitis in babies is not just a little cold. Their airways are tiny, delicate, and can become inflamed very quickly. And when that happens, breathing, something we take for granted, becomes hard work for them. Today, we're going to break down exactly what bronchitis in babies looks like, what causes it, when to worry, and most importantly, what you can safely do to help. Let's get started. What is bronchitis in babies? Bronchitis in babies happens when the bronchial tubes, the air passages that carry air into the lungs, become inflamed and filled with mucus. Think of your baby's airways like small drinking straws. Now imagine those straws becoming swollen and clogged with thick mucus. Air can't pass easily. That's why you hear wheezing, coughing, or fast breathing. In infants, bronchitis is often linked to viral infections. Many people confuse it with a regular cold, but the difference is location. A cold affects the nose and throat. Bronchitis affects the lower airways. In babies under 1 year old, doctors sometimes classify similar symptoms as bronchiolitis, which is inflammation of even smaller airways. The symptoms can overlap, and both conditions require careful attention. What causes bronchitis in babies? Most cases of bronchitis in babies are caused by viruses. Common triggers include respiratory syncytial virus, RSV, influenza, common cold viruses, exposure to cigarette smoke, air pollution, crowded environments like daycare. Here's something many parents don't realize. Babies don't have fully developed immune systems. Their defense system is still learning. So when a virus enters, inflammation can escalate quickly. Secondhand smoke is a major risk factor. Even if smoking happens outside, residue on clothing can still irritate a baby's lungs. This is called third-hand smoke. And yes, it matters. Symptoms of bronchitis in babies. Now let's talk about what bronchitis in babies actually looks like. Early symptoms may resemble a mild cold, runny nose, mild cough, low-grade fever, slight fussiness. But as inflammation spreads to the airways, you may notice persistent cough, sometimes worse at night, wheezing, a whistling sound when breathing, fast breathing, chest retractions, skin pulling in around ribs, difficulty feeding, extreme tiredness. If your baby is breathing more than 60 times per minute, struggling to breathe, or turning bluish around the lips, that is an emergency. Seek medical care immediately. Trust your instincts. If your baby looks not right, don't ignore that feeling. How doctors diagnose bronchitis in babies? There's no single test for bronchitis in babies. Doctors usually diagnose it through physical examination, listening to the lungs with a stethoscope, checking oxygen levels, reviewing symptoms and medical history. In some cases, especially if symptoms are severe, doctors may order a chest X-ray, oxygen monitoring, viral testing. The goal is to rule out pneumonia or more serious conditions. Remember, antibiotics do not treat viral bronchitis. That's a common misconception. Antibiotics only work for bacterial infections. Treatment for bronchitis in babies. Here's the honest truth. There is no quick cure for viral bronchitis in babies. Treatment focuses on supportive care. At-home care. Keep baby hydrated. Breast milk or formula helps thin mucus. Use saline drops and suction. Clear nasal passages before feeding or sleep. Humidified air. A cool mist humidifier can ease airway irritation. Elevate slightly, safely. Keep baby upright while awake to ease breathing. Rest. Their body needs energy to fight the virus. Do not give over-the-counter cough medicines to infants unless specifically prescribed. Many are unsafe for babies. In the hospital, severe cases. If bronchitis in babies becomes severe, doctors may provide oxygen therapy, IV fluids, breathing treatments, close monitoring. Most babies recover within 7 to 14 days. The cough may linger a bit longer. When should you worry? This is crucial. Seek immediate care if your baby is breathing rapidly or struggling, has ribs visibly pulling in with each breath, cannot feed, has fewer wet diapers, has a high fever, especially under 3 months old, appears unusually sleepy or difficult to wake. Babies can worsen quickly. Early action makes a huge difference. Can bronchitis in babies be prevented? You can't prevent every virus, but you can reduce risk. Here's how. Wash hands frequently. Avoid crowded spaces during peak virus seasons. Keep sick visitors away. Avoid all smoke exposure. Stay up to date on vaccinations. Breastfeed if possible. It strengthens immunity. If your baby was born premature or has underlying lung or heart conditions, speak to your pediatrician about additional preventive options. Prevention isn't about fear, it's about preparation. A real-world story. Let me share something that many parents relate to. A mother noticed her 4-month-old had a mild cough. She assumed it was just a cold. 2 days later, the baby began breathing faster and refusing feeds. When she arrived at the emergency department, oxygen levels were low. Thankfully, with oxygen therapy and monitoring, the baby recovered fully. The lesson? Don't wait too long when breathing changes. Bronchitis in babies can start mild but escalate quickly. Long-term effects, should you be concerned? Most babies recover completely from bronchitis. However, some may experience recurrent wheezing, increased sensitivity to respiratory infections, higher risk of childhood asthma, especially if there's family history. This doesn't mean every baby with bronchitis will develop asthma. It simply means monitoring matters. If wheezing continues long after recovery, follow up with your pediatrician. Myths about bronchitis in babies. Let's clear up some common myths. Myth: antibiotics fix bronchitis. Truth: most cases are viral. Myth: cough suppressants are helpful. Truth: babies need to clear mucus. Myth: if there's no fever, it's not serious. Truth: breathing difficulty matters more than fever. Myth: it's always just a cold. Truth: location of infection makes a difference. Education protects your baby. Emotional support for parents. Watching your baby struggle to breathe is terrifying. It's normal to feel anxiety, guilt, helplessness. But remember, viruses are common. You didn't cause this. What matters is awareness and action. You are your baby's first line of defense. Smooth recap. Let's quickly summarize. Bronchitis in babies is inflammation of the lower airways. It's usually caused by viruses. Watch for wheezing, fast breathing, feeding issues. Supportive care is the main treatment. Seek medical help if breathing worsens. Prevention reduces risk but cannot eliminate it completely. Knowledge reduces panic. If this video helped you understand bronchitis in babies more clearly, don't keep it to yourself. Like this video. Subscribe to Balanced Motion Health. Share it with a parent who needs this information. And most importantly, trust your instincts. Because when it comes to your baby's breathing, early awareness can save lives. We'll see you in the next video. Stay informed, stay empowered, stay healthy.